Okay, so hey everyone, welcome to another episode of the Project IMG interviews. Our guest today is an incoming PGY1 family medicine resident, Dr. Sohail Anas. Welcome, Dr. Anas, and congratulations once again on this amazing achievement. It's nice to have you with us.
Thank you for having me, and I just want to also thank Project IMG for letting me help everybody else.
Yeah, thank you so much for the opportunity. Also, so we'd like to just start with a brief introduction. So, can you introduce yourself briefly? Tell us about you, your USMLE timeline, and your year of graduation or the school, and also the school you graduated from.
Yeah, for sure. So, like you've introduced me already, my name is Dr. Anas Sohail. I'm an incoming family medicine resident at Carle Carle Foundation Hospital in Illinois. I'm a non-US IMG, like a lot of the viewers I assume will be.
Yeah.
And last year, I actually didn't match. So, I learned a lot throughout this whole process. I ended up matching this year. I think you asked me, also where I graduated.
Yeah.
I went to Caribbean Medical School called Aureus University in Aruba. So I just, graduated that last year. And then what else was it that...
Your USMLE timeline, how was the timeline? When did you take a step one? When did you take a step two? Mm-hmm. Yeah, how was the timeline for you?
For me, between basically second and third year,
okay,
i.e. between, the basic sciences versus the clinical sciences, I took step one, just so I have like an understanding of what's going on when I'm actually in the clinic. So I did that. Then I started my clinicals from third and fourth year. Between my third, a little bit, somewhere around my fourth year. So it was a year apart. I took my step two.
Okay.
And now I'm preparing to write step three.
Oh, that's great. That's great. So you matched in family medicine. So what are the factors that made you choose family medicine over like internal medicine? Because, you have a lot of IMGs going into the internal medicine line. So what made you choose family medicine over internal medicine?
So personally for me, I had so many different interests that I couldn't really just pick one thing. Luckily, family medicine encompasses all.
Everything, obviously.
Yeah. And, a lot of people have this idea that in family medicine, you're just going to be working at the clinic. But a lot of people don't know that you can actually even do a fellowship in emergency medicine or, sports medicine, and you can be a hospital. You can do so many other things. And I was like, I would like to have that flexibility to be able to do what I want and be able to see whoever I want.
Oh, that's great. That's great. So you took our time to prepare for your step one, obviously, because I know in Caribbean medical schools, I was in the Caribbean medical school before I transferred. And I know between MD5 and your CR1, most times students take out time to prepare for their step one. So how did you deal with burnout during your preparation period? And what advice would you give to students who are experiencing burnout during their step study?
Yeah, especially with step one, because it's just that first exam, It's definitely the hardest part. I even created this video I was watching the other day where I was literally yelling at myself. I was like, stop being a little, this and that, like get your things together, because first of all, I didn't know how to study properly. And I was just telling you, stick to UWorld. And then for any of your weak areas, supplement with other stuff. But for me, I was doing like Kaplan QBank, Pathoma, sketchy videos, like everything, Anki flashcards. So of course I was going to burn out. So, once I figured out like what I need to do, that helped a lot. And then the ways that I overcame the burnout essentially was A, working out, B, just a lot of mental, just, fighting myself like, hey, listen, the longer I do this, it's like the longer I'm going to stay in hell. So just finish it.
Get it over. Yeah. Okay. So, during what type of US clinical experience did you do, and how was the process of getting your US clinical experience?
So, as part of this is for majority of Caribbean medical schools, if not all. After we do our basic sciences on the island, all of the clinical experiences are done in the States. So most schools have affiliations with different doctors, and that's how I was able to get all of my main ones, like surgery, OB/GYN, IMFM, and all. But after graduating, and this is, I guess, where a lot of the foreigners, this might help them, is you don't have your school to back you up. So how do you find those externships, observerships, and all? So for me, it's because I had already applied last year, I knew the programs that I'm going to apply to again. And so I emailed every single coordinator. I asked them, hey, can I do an externship or an observership? All of them either didn't respond or some did, but like nothing ended up working out. But one of them did let me do an observership.
That's good.
So I basically ended up getting experience there. The other thing that I did was I attended a conference. At that conference, I met a resident. The resident was close to another physician. That physician was willing to take me. And so essentially, these are kind of ways to figure it out yourself. You just have to network and reach out to as many people as you can.
Okay. So how many letter of recommendations were you able to upload during like your match process?
Yeah. So for each specialty, you can upload up to 4 LORs. Most programs only require 3. I'm very honestly, I did apply to, FM, IM. So I was able to have 4 LORs for each specialty.
Okay, that's good. So does research matter for primary care specialties for like family medicine? And did you get to do any research also?
Sorry, what about research?
Yeah, I was asking that, does research matter when it comes to primary care specialties like family medicine? And did you also get to do any form of research?
Yeah, absolutely. So last year, the first time I had did not match.
Yeah.
I only had 2 publications. That year, which went by, I ended up going from 2 to 11. And the big thing here is I spoke to so many program directors at the AP conference. And for anybody who's interested in family medicine, you have to go to that conference. Like I can't stress that enough because I got literally 3 interviews from there. So going back to the research part, I've had program directors go, okay, cool, this is really good that you're doing this research. But to be quite honest with you, especially with like community programs, they don't really care.
Yeah.
It just looks good on the CV. So don't worry about what type of research and this. Just show a good number of research. So like look in family medicine or for any specialty, it tells you the average number of publications that people have that match into that specialty.
Yeah.
So as long as you had that number of publications or more, you'll be fine. And even if you don't, it's more important to get clinical experience than it is to get research experience, unless you're going to some sort of university program.
Yeah. Okay. So we obviously with a lot of things to do during the match process, you have to submit your CV, your LORs, and all that. How did you? I mean, I know that the burnout for studying for an exam is one thing, but there is a type of exhaustion that comes with this entire application process for the match. How were you able to navigate it mentally and like remain stable enough to get the entire process done?
So ultimately, how did I stay stable throughout this whole process? Like just keep myself.
How did you keep yourself sane, literally?
Just to clarify, was this after I didn't match, or was this during the step studying process?
No, this was after you didn't match and into now, like this, your second match application.
Okay, yeah, perfect. So for me, besides the stuff that I mentioned, like working out and all of that stuff, it was the mindset, because I knew literally the first video that's on the main thing, when I didn't match, that same day I made a video to be posted 1 year later where I wrote, I didn't match, but in my mind, I'm already a resident. It's literally a matter of time before reality catches up to that. And the reason I say this, especially for a lot of the people that don't match, what is the difference between you and somebody who matched? You all wrote the same exams. You all have all of the same like LORs. Usually, most of them say good stuff. Like rarely does anyone's LOR say something bad. So it's like everything is pretty much the same. But the only difference is they matched and you didn't. So now, mentally, you are still a resident. You just didn't match. So just be patient and let time,
catch up.
Exactly.
Yeah. So obviously with the pandemic, a lot of students would obviously face a lot of difficulties getting like USCEs, especially with now that we have, like you said, you sent a lot of mails to a lot of doctors and to a lot of people, coordinators you knew, and you were not able to, you were only just able to get one response for your USCs, your US clinical experience. So my question is, doing a clinical experience during the pandemic or doing an externship or an observation during the pandemic, how was it for you? How was that experience for you?
All right. So during the pandemic, I remember, sorry, like the video is kind of freezing up, but
yeah, it's fine.
Ultimately, during the pandemic, I know that, a lot of the students or a lot of rotations got canceled. However, and this is just a me thing, right? I was like, this is our time to shine. Like, this is what we signed up for. Like, let's go. So even before like the vaccines had come out and everything, I was like volunteering at the hospital, doing all this stuff. And I did find doctors just, basically through connections, like, friends like, hey, where did you rotate? Where did you rotate? Where did you rotate? Oh, I know a doctor here. Here's their number. Here's their number. So one of the friends that I had gave me a number. I ended up rotating with this doctor. Although I couldn't go into the hospital, he would let me shadow him in the clinic.
Oh, that's great. That's actually really good.
The students just kind of like, didn't even show up. So.
Okay. What are the special aspects one should look to add to their CV if they want to apply for family medicine?
So aspects for family medicine. Okay. So make sure your CV does not scream internal medicine. Okay. Or any other specialty. So if your thing, like your societies, that section where it says, what professional societies you're in, and it says like American College of Physicians, ACP, and like, gastroenterology, and like, I'm not saying you can't have those things, but like it just shouldn't look like an internal medicine or surgical kind of resume, because then it's easy to see. But if it shows that you have, obviously, AAFP, American Academy of Family Physicians, you have, like mine had the Illinois Family Physicians group in it. I had American Heart Association, which,
everyone has American Heart Association.
Yeah. Right. So it's like when I'm specifically specifying that I'm in family medicine societies, it's hard for anyone to say, okay, that he's just using us as a backup.
Yeah. Yeah. Okay. So what future prospects are you looking at? And I know you talked about with family medicine, you can get to do a lot of things in fellowships. What specialty are you looking to get towards post-residency, obviously?
Man, post-residency, I have just so many different things I want to do, and just time. But anyways, ultimately, I'm gonna just ride the wave, see the 3 years how it goes.
Okay.
Maybe, just maybe, I might just finish the residency. In Canada, the same family, and I guess this is in addition to the question you asked earlier. Why did I choose family over internal? Yeah. For any of the Canadian IMGs, it is easier for you to come back to Canada with the family medicine residency, because residency here is only 2 years for family, but it's 3 years over there. Okay. So you're literally overqualified.
No, that's good.
But for internal medicine, you have to come back and you have to shadow doctors, write different exams if you want to work in the hospital, different exam if you want to work in the clinic. So it's much harder
to transition. Yeah,
exactly. So there's that aspect, but I kind of sidetracked. What was your
future prospects? Future prospects.
Right. So ultimately, I want to have my own private practice clinic, or have a group of physicians sort of work under me. But if I do decide to go into fellowship, I'm probably thinking emergency medicine or sports medicine as of right now, but that could always change.
Okay. So if there's one message you would like to give to the fellow IMGs that are watching this interview, what would that message be?
Man,
that's a tough one.
My message for IMGs is stay patient, stay consistent, and stay persistent. You got to do all three of those things. Take every opportunity that you can. Obviously, manage your time, but don't like not take an opportunity because you're like, oh, but maybe I won't be able to find something, or because by not taking any risk, that's 100% chance that nothing is going to happen, and you essentially guarantee failure. Yeah. So take risks, take chances. If you need to drive out to a conference, 20 hours, go do it. And you might not find anything, but what if you do? All you need is one person to make that connection and you're in.
Oh, thank you so much. This was really a wonderful session, Dr. Anas. It was really a pleasure talking to you and having you share your inspiring journey with us. So we'd like to, from Project IMG, we'd like to wish you all the best in your future prospects and your future endeavors. We hope to hear like really great things from you in the future. So thank you very much.
All right. Thank you, Emmanuel. Take care.